Hello friends, today we are going to discuss about a very important pathology in gynecology, and that is endometriosis. In my experience of last 8 years, we have seen sudden surge in the cases of endometriosis. Earlier endometriosis used to be a disease of wealthy people, but nowadays it is spread all across the society. May it be poor or a laborer is suffering from endometriosis nowadays. Today, we are seeing every third case as endometriosis. In every 100 cases I am operating in a month, around 40 to 50% of the patients we are operating is endometriosis. So in this video, we are going to discuss about what are the symptoms, what are the causes, and what is the treatment possibilities for endometriosis. Hello, I am Dr. Pavan Gulhane from Medigrace Hospital and Inaya IVF Center, and I am going to discuss about endometriosis with you in this video. सबसे पहले हम लोग जानते हैं व्हाट इज एंडोमेट्रियोसिस. एक्चुअली दिस इज योर यूट्रस एंड एवरी मंथ दिस एंडोमेट्रियम, that is the inner layer of the uterus, is formed right from the follicular phase, and during menstruation this entire endometrial is shed off through the vagina and it comes out in the form of menses. But in some patients this endometrium goes in the fallopian tube and comes out and lands in the abdominal cavity. It can land on the fallopian tube, uterosacral ligament, pouch of Douglas and the ovaries, and there it forms the inflammatory cascade, and this inflammatory cascade is nothing but is called as endometriosis. Today the incidence of endometriosis is around 10 to 15% in all women, and patients who are suffering from infertility, the incidence is as high as 50%. Let's know what are the causes of endometriosis. What causes endometriosis? Nowadays, we have seen there is increase in number of endometriosis patient, and that mainly is because of the dietary pattern and the food that we are eating. There is a stress that we are having. Delayed marriages is one of the important cause for the endometriosis, and having pregnancies late in the life is also a cause of endometriosis. So in diet, we have seen that the increase in the consumption of the oily and the fried food has increased in the females in the age group of college going girls. So it exposes them to higher content of the estrogen from the diet, because the snacks or the fried food that we eat is mostly pizza, cheese, burgers, sandwiches, and all these things is stuffed with the saturated fatty acids, and this saturated fatty acid contains natural estrogens, and these estrogens are going to cause increase proliferation of the endometriotic glands in the abdomen, and they will lead to the endometriosis early in the age. Another reason is increase in the age of marriage, because now because of the career oriented females, they are tend to get married late, so their abdomen is exposed to more number of cycles of endometrium in the abdomen, and this causes more inflammatory reaction in the abdomen, and chances of you are having endometriosis increases. Now let's see what endometriosis does to your body. If you have endometriosis, what symptoms you are going to have? Mostly women with the endometriosis comes from between the age of 15 to 45 years, and the significant symptom that they have is pain during menstruation. They have such severe pain that they cannot walk. They have to take medications to mitigate the pain. Second symptom can be menorrhagia. Patient with endometriosis can have adenomyosis, and this adenomyosis can give rise to menorrhagia. One more very common symptom that patient will have is going to be pain during sex. Whenever they have intercourse with their husbands, they are going to experience significant amount of pain. Other symptom can be chronic pelvic pain. Patient will continuously have pain during entire month of the cycle. Now one more significant factor that is there in the endometriosis is the pain during menstruation will start typically 2 days prior to the menses, and this is absolutely typical with the endometriosis patients. Patient might complain of pain because of the specific region of the endometriosis. Like if they have a endometriosis in the rectal area, they will have pain during defecation. If they have endometriosis in the bladder, they will have pain during maturation also. And one more significant symptom of endometriosis is infertility. Patient will get married and will try for pregnancy with the normal course, but then they will not be able to conceive for 2, 3, 4 years, and later on when they consult with the doctor will tell them that you probably have endometriosis. One more important thing that is there in the endometriosis is it is not always the severity of the disease that defines their symptoms. The patient can have minimal symptoms or no symptoms even when they have very severe endometriosis. So it is very important for all of us to know that not all the endometriosis is going to be symptomatic. So now, how do we diagnose endometriosis? See, the endometriosis, I have told you all the signs and symptoms. With these symptoms, when you go to your doctor is going to do your internal examination. In the internal examination, while examining, you are going to have a lot of pain in your pelvis. That way, doctor will come to know that you might be having endometriosis. So the most important way of diagnosing the endometriosis is clinical examination by your gynecologist. Second way is doing ultrasonography. On ultrasonography, you can diagnose the adhesions in the uterus or around the uterus. You can diagnose cyst in the ovary, that can be a chocolate cyst. You can diagnose nodules in the rectovaginal space that might cause you pain during defecation. There is another way that doctor will come to know that you have endometriosis is doing MRI. But the gold standard for diagnosing the endometriosis is doing laparoscopy. Laparoscopy is a surgical procedure where you put a camera inside the abdomen and you actually see whether you have the adhesions of the endometriosis, you have spots of the endometriosis, and that is a definitive diagnosis. And in the same sitting, on the same procedure, we can also do the treatment of the endometriosis, like removal of the ovarian cyst, division of the adhesions, and cleaning the endometriotic patches. Now, since we know what is the endometriosis, what are the symptoms of the endometriosis, and how to diagnose the endometriosis, now it is very important to know what are the treatment modalities for the endometriosis. See, if you have endometriosis, if your concern is a pain, that is most commonly in the patients who are young, not married, not willing for conception. So we can give you painkillers, we can give you hormonal treatment in the form of progesterones that last in a cyclical manner, and the treatment can be given for 6 to 8 months to 1 year, and that will probably reduce your pain during menstruation. Next is, if you are adenomyotic and you are having bleeding, then there is a possibility of putting something that is called as intrauterine device of the progesterone that will take care of the menstrual bleeding that you might be suffering from. There is one more important thing that has to be taken into consideration is, if you have an endometrioma or the chocolate cyst larger than 4 cm of the size, your gynecologist is going to advise you surgery. And if suppose you are having infertility along with the endometriosis, obviously your gynecologist is going to suggest surgery. In surgery, we do removal of the chocolate cyst, we do the adhesiolysis and separate the ovaries, fallopian tube from the uterus, and also the rectum from the uterus, so that entire pelvis is free and the chances of your pregnancy becomes more. So as I have told you, endometriosis is not so uncommon disease. It can affect female between 15 to 45 years of age group till the time your menses stops. So it is important to be aware of the disease. If you experience any of the symptoms of endometriosis, it is very important to consult with your doctor, get yourself diagnosed so that disease can be treated or the treatment can be given accordingly. So I am Dr. Pavan Gulhane from Medigrace Hospital. If you like such content, such videos, you can always follow us on our Instagram and social media platform. If you have any questions regarding endometriosis, you can always DM us. We'll surely try to solve your queries. So thank you, and I'll see you in the next video.